otherwise healthy 85-year-old woman presents with left-sided weakness. Her symptoms started 4 hours ago while she was on the phone with her niece. Patient recalls dropping the phone and not being able to pick it up with her left hand. She has no significant medical history and takes no medication. Physical examination reveals decreased sensation on the left side, which is worse in the left side of the face and left upper extremity. Patient has significant weakness in her left upper extremity as well as weakness and drooping in the left lower face, left half of the left side of the face, lower half of the left side of the face. Ophthalmic examination reveals conjugate eye deviation to the right. Non-contrast CT scan of the head is unremarkable. Patient is started on aspirin. Contrast CT scan of the head a few days later reveals an ischemic stroke involving the lateral convex of the right cerebral hemisphere. Which of the following additional finding would most likely be seen in this patient? Amaurosis fugax, profound lower limb weakness, Horner syndrome, homonymous hemianapsia, and prosopagnosia. So again, this is a stroke patient that involves the lateral convexity, as I mentioned over here, of the right cerebral hemisphere, which is most likely involving your middle cerebral artery because that's what supplies your lateral portions. That's what the major supply to your brain is, right? Patient symptoms started about 4 hours ago, right? That shows that it is an acute ischemic stroke, usually occurs due to arterial occlusion. It could be a thrombus and it could be an embolus. Patients will usually present like in this patient, they have left-sided weakness, so contralateral hemiparesis and even sensory loss. If they involve the parietal lobe, and they do, right? The MCA supplies your parietal lobe. Now, depending on which side of the MCA is involved, your patients will have different symptoms. So if your left side is involved, it's gonna cause aphasia, right? Because your Broca's and your Wernicke's areas are on the left side. And if the right side of the hemisphere is involved, like in this patient is gonna have left hemi neglect and apraxia, where you will not be able to perform tasks even if you understand what is going on. Okay? First thing to do, as they did in this patient, is to do a non-contrast CT scan of the head. Why we do a non-contrast head CT first? Why do we do non-contrast CT scan of the head first? Why can't we just directly do this contrast? So we do not want to use contrast when there is bleeding and when there is stroke. As we know, we have two types of strokes, right? We have hemorrhagic and we have ischemic strokes. So to rule out hemorrhagic stroke, we need to do a non-contrast CT scan of the head. Okay. Once that is ruled out, you can use contrast to look for ischemic strokes later on. Okay, so that's one thing that because you don't want to give contrast to somebody who has internal bleeding. Another thing is that if the patient presents within like I think 3.5 hours, you can also give them TPA. TPA is the tissue plasminogen activator, right? That is to dissolve the clot. Especially this is the treatment for ischemic kind of stroke. But you cannot give TPA to somebody who is having bleeding because it's going to cause more bleeding. So to even rule that out, that is the major treatment actually for acute ischemic strokes. And so you cannot give TPA to somebody who has hemorrhagic stroke. So first we need to do non-contrast CT scan of the head. If that is negative, patient is within 3.5 hours, you give TPA. This patient presented after 4 hours, and that's why they just started him on aspirin, right? They didn't give TPA because that's not the correct. She was not within the period, the time period. What they would do is that after you start them on aspirin, you can do contrast CT to look for the ischemic stroke where exactly it is, and then you can do the reperfusion therapy like endovascular and just go into the artery and open up the clot basically. So other options like amaurosis fugax, what that even means. Amaurosis fugax means transient painless loss of vision. It could be in one or it could be in both the eyes, and it's usually because your ophthalmic artery is in. Now this could be a clot, this could be an embolus, and it could be even the artery itself, what we call carcinoma, and that's what would cause amaurosis fugax. Usually they will gain the vision back once the clot is resolved. Profound lower limb weakness. So lower limb, if you remember, your homunculus is towards the midline, right, towards the middle side. and middle portion is supplied by your anterior cerebral artery, your ACL. So this patient had, since lateral convexity being involved, your lower limbs are spared. Horner syndrome, somebody tell me the triad for Horner syndrome. So that's ptosis, meiosis, and anhydrosis. That's the triad for Horner syndrome. And that happens because you have damage to your sympathetic fibers. You have central sympathetic fibers and you have your peripheral as well. So central comes from your hypothalamus to your spinal cord, starting from T1 level. From there, they go to your superior cervical ganglion. From there, you have your postganglionic neuron that goes to supply your muscles, basically, right? Passing through the base of your skull. Now, wherever these lesions are, let's say from hypothalamus to the spinal cord, it's going to pass through your brainstem. So if you have a brainstem lesion, you can have a Horner syndrome, right? If you have superior colliculi, sorry, not superior colliculi, superior cervical ganglion being involved somewhere, like in Pancoast tumor, it will also cause Horner syndrome. So many things can cause Horner syndrome, but not in this patient because this patient had a major cerebral infarction. That doesn't affect your hypothalamus or any central areas where your sympathetic tract. Now, last one is prosopagnosia. Prosopagnosia is basically inability to recognize someone, recognize faces, right? And that happens with the posterior cerebral artery lesion when you have your vision mainly being when you have your vision center, which is your occipital lobe being involved. And occipital lobe is supplied by your posterior cerebral artery. Okay, so again, not seen.
Thanks for watching. Please give a thumbs up and subscribe for more.